by King's College Professor of Biological Psychiatry, Carmine Pariante. Carmine, good to see you. Thank you for speaking to us this afternoon.
Thanks for having me.
Antidepressant use has increased in recent years. There's an estimated 1 in 7 people in England taking the more than 20 million antidepressants prescribed in just 3 months last year. Fewer pills, more therapy. In your opinion, is this a good move?
So we already knew that for people with low severity of depression, what is called mild depression, antidepressant should not be the default practice or the first step. And this has always been the recommendation from NICE guidelines and from the Royal College of Psychiatrists. What I think these NICE guidelines add is offer a wider range of evidence-based psychosocial or psychological treatment that perhaps before we didn't have enough evidence to recommend. I also think that, the issue is not how many people are taking antidepressants. The issue is that the right people who really needs antidepressants take them. And the guidelines really stress at the beginning that because of depression, because of the difficulties of being depressed, or because of the stigma, a lot of people with depression do not seek treatment. So there are people out there who are severely depressed and are not seeking treatment and may really benefit from antidepressant. So not necessarily fewer people on antidepressant, but certainly the right people on antidepressant.
The idea behind these new draft guidelines is to start a dialogue between a doctor and a patient about what would best suit the patient. And the kind of things that are in these guidelines to be offered to patients are group exercise, meditation, and something called CBT, cognitive behavioural therapy. Talk us through how this helps. And CBT, for example, if people don't know what that is, what is it and what are the proven benefits?
CBT is certainly the psychological intervention that has the strongest evidence base, has been basically demonstrated to be effective in depression in a variety, in many clinical studies. It's based on the notion that one of the factors that maintain depression or is a risk factors for depression is negative way of thinking about themselves. So, for example, negative expectation or negative opinion of oneself, or also negative expectation and opinion of the world around us. So a therapist, either in a one-to-one session or as part of a group, would challenge this negative way of thinking and suggest alternative, more positive way of thinking. And it has been clearly shown that this improves the depression. Now, this is the cognitive element. The behavioral is adding this thinking element with a practical element. So it could be, for example, really recommending to someone who is depressed to make an effort to go out and, for example, do physical exercise. That's a change in behavior. Or engage in social activities, perhaps even just seeing friends and relatives, because although someone with depression may not feel like doing something like this, after that they may feel better. So it's both changing the way people thinking negatively, but also helping them to do behavior that are more helpful.
Yeah, Carmine, it sounds like the NHS is trying to make a real shift here in terms of, like you said, those with mild depression, rather than going on drugs, finding different ways of being treated. But is the reality that there isn't the support network there to support this shift? Because already people are on long wait lists for therapy, it's not readily accessible. Even if you go privately, it's expensive, there aren't enough practitioners. What's the real picture? Because it's all well and good creating this shift, but if there's nowhere for people to go, it's pointless.
That's true, but I think it's important to kind of remember that the United Kingdom has one, if not the best, system for psychotherapeutic intervention available in the NHS, what we call improved access to psychological therapies or IAP services, which are very well eradicated across all NHS settings, and it's something unique in the world. So in a lot of other countries, psychotherapy is not available outside of the private areas. So there are waiting lists, and of course, with COVID and the difficulties we're having at the moment, there's even more pressure. But the NHS is really trying to do, really miracles and leading the world on this.
Yeah, I think it was the mental health charity Mind, a spokesperson for that charity, welcomed the guidelines, but warned that more funding was needed to deal with the huge demand for mental health services that are already there. Carmine, I wonder if you could give us a final thought in terms of when it comes to depression, obviously you were keen there to make the distinction between mild depression and something that, you know, can blight people's lives. For those who do go through depression at the moment, and it's something we particularly talk about coming through this pandemic, is it something that people could always live with, or is it something that people will have at a certain period in their life and through these kind of therapies we've been talking about can move on, or is it a system of maintenance throughout your entire life?
Different individuals will have different trajectory. A lot of people will only have depression once in their life because something really bad happens around, you know, their social environment and their family. Some people are so susceptible they will develop one depressive episode after the other, and perhaps will at some point contemplate taking their own life. And within this kind of range of pictures, everybody will have a different trajectory.
Yeah, a different experience for everyone, and like you said, the NHS trying to offer a personalised treatment plan for people as well, because it does vary from person to person. Carmine Pariante, King's College Professor of Biological Psychiatry, really good to talk to you.